back to my channel. Okay, we're just gonna redo that really quick because no. And see, no, I'm still messing up. I need to get it together.
Play I get it from play I.
2 hours later.
Okay, I'm ready. Hello everybody, welcome to my channel. I'm Nurse Jasmine. If you've been here before, welcome back. If you're new, welcome. Today I have a video for you guys about my experience as a new grad in the CVICU. I'm just here to kind of share my journey, share how I got there, and give any tips or advice that I have either gathered on my own or got from other people along the way. First and foremost, if you are in nursing school right now, or if you're in a different specialty outside of critical care, I just need you to know that it is very, very, very possible that you can come into the ICU with absolutely no nursing experience and no ICU experience. Of course, it's always recommended, at least for me through my journey in school, we always got recommended to start in med-surg, in step down, whether that was tele or PCU, and then to gradually move up to critical care. Do I recommend that? Absolutely. However, if you are somebody who is up for a challenge, you think you can hang with a fast-paced environment, and you know that's what you want, then why waste time going to another unit? Just go straight into ICU. That was something someone told me during my preceptorship, because I was always asking around like, hey, you're here, you're a new grad or you're a newer nurse, what was your journey? I talked to nurses who did the whole med surge and then transitioned to critical care, and then I talked to nurses who went straight into critical care from nursing school, and literally everyone said, like, if you know this is where you want to be, like, just do it. So I just wanted to give that food for thought for anyone who might be in that predicament and is not really quite sure how to how to get there. I started job shadowing for different positions during my second to last semester in nursing school. I highly recommend job shadowing as soon as possible. I don't care if you don't graduate for a year, for a semester, for a month. If you're already graduated, like, job shadow, because you need to get a feel for the environment you're about to commit to. And yes, you're committing, because as a new nurse, it is not a good look to hospital hop. It doesn't look great on your CV, and also, like, you're in a place where you're taking in so much new knowledge that it's almost smarter for you to do for yourself to just stay in one place. I'm speaking again, these are my personal opinions, personal experience. I love where I work, but I want a little more, so I'm already like looking into how I can get more without kind of like ruining what I've got going on for myself now. But anyways, story for another time. But let me tell you something. Job shadow. I know I just said that, but as soon as you can. I thought I wanted to work in the NICU. I job shadowed for 8 hours in a NICU, and I knew, like, oh my gosh, this is hard. I don't think this is for me. I give all my respect to all my NICU nurses, because you guys are just really amazing people. I left that shadow and like got really emotional because it's just so sad, like, for the parents, for those little micro preemies, like. So anyways, I shadowed in the CVICU, in a couple different CVICUs. I shadowed in a general ICU, and then I shadowed in a dermatology clinic. And usually the way I get these job shadows, or had gotten these job shadows, Carlos, stop chewing on my chair. No. Sorry. The way to get your job shadows, right? You're going to, what worked best for me was just interviewing and asking during the interview, and they're like, oh, do you have any more questions? Just throw it out there, like, hey, I'm really interested in this specialty. I really, am enjoying this experience talking with you guys. I was wondering if it'd be possible to kind of have the opportunity to job shadow, just to get the feel of the work dynamic and see if this is a place that will be suitable for me. And that is okay. Most people will actually already offer you a job shadow opportunity, or would really respect and appreciate that, because it shows that you care about job satisfaction and you're ready to kind of just give your all, like, as long as a place as long as you're in a place that suits you. So that really worked for me. Another thing that worked, I scored a shadow through a brain fog. Sheesh. Like the hiring events. That's not what we call them though. They were mixers. Some of the hospitals would put on mixers where they would have all of their hospitals or a representative from each unit from their hospital come, and you know, you could mix and mingle and talk to these hiring managers and just managers of the unit right then and there. There's your opportunity. You tell them, hey, I'm really interested in working in ortho or in oncology or critical care, and I've heard really great things about, you know, the unit at this hospital. I'm wondering if there's a possibility that I could come and job shadow for maybe 8 hours. And they would be like, oh yeah, absolutely, because let's be honest, they're in these mixers and hiring events because they need nurses, they need staff, so they'd be more than happy to show you, you know, their unit. So anyways, I just recommend this because you don't want to get stuck in a place where, although it sounds nice, you end up going and realizing like, whoa, this is really chaotic. Whoa, there's no organization. Oh wow, your guys' turnover rate is ridiculous and I see why. Or, you know, you're gonna be there for at least a year, at least 6 months minimum. Yes, try to get a shadowing opportunity just to make sure you're making the right decision for yourself. As for working on the unit, goodness, let me tell you guys, there is so much to learn, so much you're going to see, so much you're going to do. So working in critical care out of nursing school, I'm gonna tell you right now, it's not for the weak, but if you know this is what you want, do it. You're only gonna grow. It's only gonna get easier in time. Sure, it might take a full year for you to get comfortable, maybe more than that, but like, you're doing what you need to do to get there. You know what I mean? On my first day, I had an organ donor patient. So it was through Life Center, so of course, you know, it was a very strenuous, long, sensitive, delicate process. First week, my first 3 shifts, I had experienced 2 different deaths. I already did CPR. Oh man, I want to tell you guys that story so bad, but I don't want to get too into things that are not going to help you. If you work in critical care, you're going to get a lot of codes. If you get codes, or if other units get codes, you work in critical care, you're the code team, you're the rapid response team. So prepare for that. That's something to keep in mind. Yes, it's exciting. Yes, it's traumatizing, but you take a little bit away from each time. You know what, let me tell you something. I'm just gonna tell you guys my CPR experience. I'll try to make it quick. One thing that you need to know as a new grad in the ICU is to know how to read a room. There was a code happening. Actually, I was in the room with the doctor, with the attending. He was doing a bedside bronch, and as he was finishing up, we hear the alarm and he's like, is that a code? And we look out, yes, it was a code. So we wrapped up in there, went over to this lady's room, and or it was a man, excuse me, sorry, this was so long ago. Look, 1 week in your orientation period literally feels like a whole like month or a year. Like, it's crazy how my perception of time has changed. But we went over to the code room. I noticed everything, you know, every role was kind of taking place, but I did notice there was only one person doing compressions, and she looks up at me and she's like, Jasmine, do you want to compress? I'm new, I'm hungry, I'm eager. I'm like, yes, I want to do this. I didn't really know what to do, okay? I'm gonna be honest. When it's your first time in real life, like, yo, it's the pressure is on when it comes to these very high intensity situations. My tunnel vision is insane. Like, I've gotten, you know, a couple feedbacks about like how I maintain myself really well under pressure. So anyways, I go to the bedside, she's doing her thing, she's counting, and I'm just, you know, I'm getting myself ready. I'm pumping myself up in my head like, you got this, you're a bad bee, like, because you're going to be your biggest hype man, okay? You are going to be your biggest hype man through this process. I don't care what anyone says, that is the truth. So next thing you know, as I'm going to step up, as we're swapping, for some reason she pushes the step stool aside, and so I fumble, I fall, of course, not on the floor, not on the patient. I just stumble and catch myself. Doctor's like, all right, ladies, get it together. So I start compressing, and I realize immediately I forget my CPR song. and I'm just looking down, and this person's like foaming red stuff out of the mouth, and I'm just like, what is going on? Like, I've been a nurse for 2 weeks, and I'm just thinking to myself, like, this is not a mannequin. This is not a mannequin. And she's like, Jasmine, you know, hurry it up. Do you guys want to know what my CPR song is? Baby shark do 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 do, baby shark do 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 do, baby. Right? Another one bites the dust. Boom, boom, boom. There's a fire starting in my heart. You know, like, I have so many, but Baby Shark is my go-to, and I'm like, Baby Shark, baby, this is not a mannequin. It was traumatizing. If you've never seen CPR in real life, brace yourself and prepare. It is the smells, the sights, the chaos. So that's something to look forward to. Know your CPR song. Don't get caught up in the moment trying to remember it. Just like, I probably should have prepped myself before with the song itself instead of hyping myself up, telling myself, you know, I'm a bad bee and I got this. So anyways, that's just another thing. Being organized and staying on top of stuff is going to be your best friend. Whether it's staying organized with your charting and medications and knowing when to give what, or staying organized in your your days off, doing things you know you need to do, because it's too easy to get caught up on a day off doing absolutely nothing, and then it kind of just throws off your whole like life vibe, if you know what I mean. And then even like in the rooms, keeping your rooms clean, keeping your lines organized. I finally understand why they say never touch our ICU nurses' IV lines, because it can get crazy. I've already worked with patients who have had like 3 IV pulls, 2 to 3 brains on each pull with max amount of channels on each brain, and it gets intense. So organization is going to be key. I had to do make myself like homemade checklists just to make sure I was hitting all the marks on charting, because there's so much to chart and it's so easy to get behind if you're not staying on top of things or taking advantage of your downtime. And I mean, I've seen nurses have to stay over, like, you know, from night shift, and even day shift nurses have told me they've had to stay over into the night shift up to like 2 hours just catching up on charting, because there's a lot of events that happen, there's a lot of medications, there's a lot of titrating, and like you literally have to chart on every little thing that you do. So that's another thing to keep in mind. You're never going to be alone. It is an intimidating environment. You know, you're going to be working with people who are at different levels, different, you know, years of experience, different personalities, but just know that you're never alone, and there's always going to be people to support you. Even when you feel like, oh, I don't want to ask my question, it's so silly, just ask. Just ask, whether it's your preceptor, a fellow new grad who just got out of orientation and you're kind of comfortable kikiing with them, like, ask somebody. Because these nurses care more about the patients than like our discomfort, you know what I mean? So finding clarity or asking a question to ensure the safety of your patient, like they're going to be on it, they're going to appreciate it. Also, ICU nurses, since we're kind of on this topic, they're built different. And I truly know this from past experience, because the CVICU was the first unit I ever worked in at a hospital as a tech, and also as a PCA. I was a cardiac tech in one hospital and a PCA in another at the same time, pre-COVID, during COVID, and post-COVID. It was wild. And so I do know from experience, ICU nurses, especially CVICU nurses, are built very different. Lots of type A personalities, but very different personas, if that makes sense. So you're going to have to go through this, and maybe it's different at every hospital, but from my experience, you kind of have to earn their trust and respect. Mind you, you're going to be working with the sickest of the sickest patients, the highest acuity like out there. And so people want to make sure that, one, you're here to take it serious, 2, you're open to learning. The first thing they all noticed about me, they're like, wow, you are very in tune, you know, and I am. I watch and listen to everything. I can't help it. But so yeah, you kind of have to earn that trust, earn their respect. And by doing that, what's worked for me and what might work for you, this goes for any body in any unit. That's probably whether you're having a hard time fitting in or finding your place, or you're brand new and don't know a lick about anything or anyone, let them know you're there for them. If you have some downtime or you find yourself, walk around, check up on people. Hey, are you doing okay? Hey, is there anything you need? Do you need help with anything? Just like that, you know, and it kind of shows them like, wow, you know, she's here for us. She's our teammate, and you're not too timid about things. You're not shy. You're there to learn. You're there to help. People will appreciate that and actually notice that about you very quickly. And it'll only bring good results. I can promise you that. No nurse is going to be annoyed by another nurse offering their assistance. You know, it doesn't work that way. And if they are, then maybe just don't ask that person if they need anything. I haven't encountered that from anyone. Most people are just like, oh no, I'm good, thanks. And then you notice they do the same thing later to you, and it's great. Study your medications. You're never gonna stop learning. Nursing is a lifelong educational journey, and there's always gonna be new things for you to learn, new things for you to understand, new concepts for you to process, whether it has to do with your unit or if it's part of your nurse residency program like the one I'm in, or every day there's just like a new concept or a new medication that I'm introduced to. And if I don't know med, I typically write it down, look it up in Lexicomp on Google, understand how it's affecting this person's system and why we need to give it to this person. For example, you have your different ACLS meds, you have your different blood pressure meds, right? And although they all affect I'm just thinking of 4 specific ones, though they all affect the blood pressure a little differently, it doesn't hurt to take advantage of some downtime and understand, like, well, if they all lower your blood pressure, why can't we give this one to that? Well, maybe that medication also lowers the heart rate and this patient already has a low heart rate. Something like that. Just understand the why. You know, you don't want to be an ICU nurse or a nurse in general that comes in and you're just like, well, I'm hanging this dopamine, I don't really know why, it's just there's an order so I'm hanging it. No, understand, like, why are you hanging that dopamine level? I'm still very surface level with things. I'm kind of just in that introductory period, but yeah, understanding the why, and that kind of goes along with asking all your questions. Like, don't hesitate. Another thing is to try to have fun with it. It's already serious enough as it is. You know, you're working in this unit with all these very, very sick patients, and they're relying on you, and it can be hard and it can be stressful, especially if you make a mistake or something doesn't go right. But have fun with it. And if you do make that mistake, and when I say have fun, I mean, like, you don't have to go in being this highly serious person who's just here to learn and just here to work. Like, no, have that silly conversation with your coworker while you guys are all caught up and everybody's stable, all your patients are stabilized and you're good, you know? Go out with your coworkers after work, go grab a drink, grab a meal, whatever they do, you know, get to know them. And on your days off, do things that you enjoy and that bring you happiness. Another thing that I wanted to touch on is giving yourself grace and forgiving yourself for making a mistake. I don't care how long you've been a nurse. I don't care if you've been doing this for 4 years, 4 weeks. Mistakes are bound to happen. You know, we are not perfect. We are human, and humans make mistakes. Also, there are things you can do everything right and the result just is not what you were hoping for, and that's okay. As long as you know you're doing your best and you're putting your best foot forward and you're giving 110% every day and you're showing up for yourself, for your coworkers, for your patients, and you're advocating and you're doing everything you need to do, if something goes wrong, it is okay. It's okay. Process it though. Talk with your coworkers, talk with your friends outside of nursing, you know, that always helps. But talk to people and give yourself grace. Whoa. You guys should see the way I have my camera set up right now. It's a hot mess. But look, it's working. So anyways, another really good thing to keep in mind if you are considering working in the ICU as a new grad, honestly, no matter where you go, have a good self-care routine for yourself. And self-care comes in a variety of forms. One person's self-care might look different than yours, and that's okay. So some things that I do to kind of just help process just my feelings and my progression throughout my residency is I come home, I only do this some nights. I don't do it after every shift because I'll be honest, sometimes it can feel like a chore. Sometimes I get off and I want to do absolutely nothing at all. But I try to journal, especially on the days that are like emotionally heavy. I journal, I keep fresh eucalyptus in the shower that I try to change out weekly. I cuddle my dog. Sometimes I'll go for a night walk with my dog. And then also on my days off, I make sure, as I previously mentioned, to just do something that brings me joy, that makes me happy. Whether that means read a book, do a puzzle, build a Lego set, play some games, like those are just things that I enjoy. Self-care is very, very important. And even finding little techniques that you can incorporate while you're on your shift or right before your shift, if that means, you know, meditating in the car for just 60 seconds before walking into the building. Or I have these healthcare affirmation cards that I'll read in the morning, read in the middle of my shift, and then sometimes I'll read it after my shift. It just really depends on the day, but whatever you have to do, find your self-care routine, stick to it, get some exercise, start eating healthy, and you know, everything will fall into place as it should. You don't have to be a perfect person to work in the ICU. You don't have to be the smartest of the smartest. And if it takes you longer to catch on or to absorb the content than someone else, like, that's fine. That's another thing. Like, don't compare yourself. Your progress is your progress. Your journey is your journey. If you need more time for orientation, ask for it. If you feel like orientation is too long, let them know and come out of it early. Again, this is your experience, this is your journey. So try not to compare yourself to other people, because that will just kind of like, you'll just be doing yourself a disservice. You know, at the end of the day, we're all growing, we're all learning, and we all have different goals. So as long as you're on track to meet yours, you are doing an amazing job. Yeah, but other than that, don't feel pressured to get too far ahead. Focus on the right now. And I just had this conversation with my boss the other day because I had like a little bit of a mentee bee about if I'm doing the right thing, if I'm in the right place for my future goals. And I mean like future goals, like years out, things I really shouldn't be so stressed about right now, but I am, because that's just me. And he was just telling me, like, enjoy the right now, take in as much as you can from the present moment, and put in the work, and the rest will fall in place. Because when plans change, and two, if what's meant to be will be. And so I just wanted to share that with you guys. If you're anything like me, my education is everything that I have. I didn't grow up with very much, so I value it a lot. Like, kind of obsessed, but like, I love to learn till it works, you know? But yeah, learning to just live in the moment and kind of take it in and enjoy the process. That was like some really helpful words of wisdom that I recently was told, and it really helped me. But yeah, other than that, I thoroughly enjoy the process. I am currently on I'm on like week 7 or going on to week 7 of my residency. I started in mid-December. My orientation period is 16 weeks long. The residency, it said it was 6 months, but I realized recently that my last residency class is actually in August. So it's great. I mean, there's been a lot of support. We do like skills labs and stuff. We do different types of residency classes. Some are in person, some are online. They're setting us up for our ACLS right now, and I say us as in like the cohort that I just started with. So I get my ACLS next week. Super excited. That's just gonna pretty much open the opportunity to like push ACLS meds during, you know, your anti-radiation during Code Blue. And yeah, I'm really excited. Sorry, there's so much hesitation because my gears are grinding. I'm trying to make sure that I hit all the good points for you guys. But for my new, like, soon-to-be new nurses out there, start shadowing if you know you want to be an ICU nurse, and find the perfect unit for you in your area. some units, you know, you'll find your way. You will. And just know I'm here for you. If you guys need anything, please leave a question in the comments. Follow me on Instagram. I'm Nurse Jasmine on Instagram. You can always shoot me a DM. I'd love to chat and help you along the way. I'm the type of person, if I have something or if I have a resource or knowledge to share, you now have that resource or knowledge. I just want to see everyone win. I want to see us all be great. And yeah, so I hope you guys enjoyed this video. If you found it helpful, please like, share, subscribe, and stick around for next time. Bye.